As you gain excess fat in the upper body, it forms an additional, very active metabolic organ. This organ generates a constant flow of harmful substances called free radicals or reactive oxidant species. Excessive formation of free radicals damages the cells. This process is called oxidative stress. Oxidative stress then triggers an inflammatory process that can affect cells throughout the whole body as they circulate in the bloodstream. When trying to protect themselves from these harmful processes, the target cells become resistant to the protective action of insulin, also referred to as insulin resistance. Can you begin to understand where your nagging urinary tract infections or sinusitis are coming from? If you are constantly exposed to free radicals from your modern lifestyle, with its quick fix, high-fat takeout meals and bad sleeping habits, no exercise, and daily exposure to environmental toxins and cigarette smoke, it makes sense that the consequence of low-grade chronic inflammation can cause havoc in your body. This chain reaction of free radical formation, oxidation, inflammation, and insulin resistance is an interactive destructive metabolic cycle which forms the underlying processes whereby you develop most of the diseases of lifestyle, like diabetes, hypertension, heart disease, and cancer. To understand insulin resistance, we must go back one step and review what normally happens in the body when we eat starchy foods like bread, potato, pasta, or fruit. Here we have the bloodstream and a typical cell, one of trillions in the body. In the double-layer cell membrane, we have a number of insulin receptors as well as glucose transporters. This represents the pancreas. When we eat starchy foods such as potato, fruit, bread, pasta, or sugary food, it is converted to glucose in the bloodstream. This rise in blood glucose signals the pancreas to secrete the hormone insulin. Insulin binds to the insulin receptor, which then sends a message to the glucose transporter and unlocks it on the cell membrane. Glucose is now taken up by the cell where it is burnt for energy, and the rest is stored as glycogen in the muscles and in the liver in small amounts. The insulin has completed its job and is now inactive, and the glucose transporter becomes unavailable. When you have insulin resistance, many of the receptors on the surface of the cells are closed. What happens now when you eat? Glucose pours into the bloodstream. This signals the pancreas to secrete insulin. However, when the glucose needs to be shuttled into the cell, it finds the receptors closed. The glucose, as well as the active insulin, remain in the blood. The pancreas will be willing to try again and will secrete more insulin just to find yet another receptor closed. The active insulin also builds up in the blood. The pancreas is very patient and will try again and again until eventually the insulin finds an open receptor. Can you begin to understand why you are constantly tired and don't have any energy? It becomes clear that your body has lost its ability to make the most of the food you eat. Your cells are not sensitive to insulin anymore and respond sluggishly to the action of insulin. Insulin controls your blood sugar levels, but it is also a growth hormone. In other words, it stimulates normal cell growth and storage throughout the body. When, however, you are insulin resistant and unused active insulin accumulates in the blood, it will begin to stimulate cell growth or increase the levels of certain substances in your body beyond what is regarded as normal. Insulin resistance, along with free radical formation and accumulation, oxidative stress, and inflammation, which form the destructive metabolic cycle, have many undesirable effects on your health.